So here are my disclosures that are relevant financially, but my real disclosure is I am still, despite the trends worldwide, an anatomic arthroplasty surgeon, and I'm going to try and tell you why. And the first thing I'll tell you, and it's the same thing I tell patients, is if God wanted your shoulder put in backwards, you'd have been born that way. And then they say, well, I don't believe in God. And I was like, well, have you evolved into a reverse shoulder? Last I heard, I mean, you know, primates still have a shoulder with the ball on the humeral side. So going back to the origins of modern shoulder arthroplasty, they were really ushered in by Dr. Neers. We all know that, with his monoblock arthroplasty design with an average size humeral head of about 44 millimeters. And this is what we now call, of course, the first generation. And it worked very well for Dr. Neer, but unfortunately not everyone could get the exact same results. And big recognitions, well, we were all different sizes. Not every patient had a 44 millimeter head. And so that ushered in what we call the second generation, where you had this iteration of where you could combine a different size humeral fixation stem with a different size humeral head to try and address the differences in patient size. And this is kind of the modular or second generation stem. And these could work well, but you can see from all these different designs here that they all didn't look right. They all didn't fit exactly perfectly right. And that kind of ushered in some anatomical studies that were done by my mentors, Yul Walsh and Pascal Boileau, where they recognized, hey, it's not just a size issue, it's also a shape issue, that we're not all built to the exact same shape. And through their detailed anatomic studies they did in the late 80s, early 90s, they found the humeral head, of course, had a variable diameter and a variable thickness and a variable radius of curvature